What's going on, everyone? Jeff Lewis of Lewis Physical Therapy and Sports Rehab here today. So we are going to be talking about a massive piece of any performance and rehab program, and that is medicine ball training more than anything. So there's a lot of different ways you can go about implementing this. I personally think that med ball work gets overcomplicated depending on the circle of or school of thought that you are coming from. But ultimately, I want to try to break down a lot of the intricacies that go into med ball movements more than anything. So a medicine ball, for the sake of this video and really for a lot of training standpoint, I really use as light as a 4-pound ball or as heavy as an 8-pound ball. I just feel like when you go heavier than an 8-pound ball, the higher velocity nature of the movement that you're trying to chase, you go heavier than an 8-pound ball, for most athletes and individuals, it's probably going to be a little bit too much. It's probably a little bit too heavy to kind of dull that velocity response more than anything. So first thing I'm going to touch on here is from a rehab standpoint, specifically in a thrower. From a PT standpoint, and I've been guilty of this as well, I think we as an industry got to the point for baseball players from a rehab standpoint where we thought we need to do every single med ball and plyo ball progression known to man before they go ahead and start throwing. And I think that was a little bit as a way, this might be a little bit controversial and a hot take to say, but I think that was a little bit of a way for us to almost validate, oh, look at us, we have all these different variations and all this and that. We're so unique in our programming, this and that and whatnot. And at the end of the day, you could take the same 4 med ball drills and just progress them over the course of a rehab, and they're probably going to be just as effective more than anything. So from a rehab standpoint, we're getting someone ready to get back to throwing. I think there is some value in it. I keep it purely extensive at this point in my career for a guy to get ready to throw. Extensive meaning it's sub-maximal intensity. You're going for more rhythm, a little bit higher volume. We're not going for high effort, high velocity throws, just building good tempo more than anything. And coincidentally, what we do from a rehab standpoint there is very much similar to how we will train youth athletes from a medicine ball standpoint. It's a lot more higher volume. It's a lot more rhythm. You're going to build some coordination and movement awareness throughout the core and throughout the core and the trunk. So that from a rehab standpoint is what I really like to focus on. Once a guy gets throwing, yes, then you can progress to different force qualities of concentric only, eccentric overload, like a lot of different ways you can go about it, different patterns. But from a med ball standpoint for rehab, like I'll show you just right now, there's really just three different patterns that you progress from. You can progress from a chest pass variation where you're just here, you're starting close body, and then you're going to more extension. You can go close body from a rotational standpoint, you're here, then you can go farther out. You can even go from the side more than anything. You're here. And then from an overhead standpoint, you just go straight overhead. For those 3 patterns alone, you are probably going to cross off a lot of the things that you would quote unquote need to see before someone starts throwing. Now, this is a conversation for another video on another day, but throwing itself is plyometric. Do we need to be doing a ton of plyometrics before throwing? Again, that's a different conversation, but that's a little bit where my school of thought is coming from a med ball from a rehab standpoint. From a training standpoint, a lot of it depends on where we're at in training. Like I mentioned before, for a youth athlete, we are probably not going to be doing any high intensity max effort med ball throws with them, mainly because they probably don't have the overall coordination throughout their body to properly synchronize what they need from a high velocity standpoint with a med ball drill. We're going to get a lot more benefit and bang for our buck in that case of using them from a higher volume and rhythmic standpoint. So what I mean by that is, let's just say I sort of have a partner here, but let's just say instead of the wall, it's a partner here. What I mean by higher volume rhythmic, they're just playing catch with their partner from a med ball standpoint. So it might be nice and easy. You're going in and just moving around. Now, anyone that has done about 50 rotational medicine ball throws will tell you it's pretty taxing not only on the core, but the arms as well. So there's going to be a lot of benefit that you're going to get from that. You can also take med ball work and include it into your tempo runs. So now moving away from the kind of youth side of things and how do we progress some medicine ball work from a training standpoint in a little bit more developed and higher training age athlete. And that is going to become one of our main high intensity elements and stressors in our program. So when we look at high intensity elements, there's maximum strength effort weights. There's going to be probably some dynamic effort weights, so sub-maximal weights lifted with a very fast intention and rate of force development, plyometrics, speed work, and high intensity medicine ball throws. These are all very CNS, central nervous system demanding tasks. So in this case, we might do, so let's just say we're taking, for example, we're going back to that overhead slam that we're doing there. Before I did it with some just kind of nice and easy movements. Now, if we're looking from a training standpoint, I might do 10 high intensity, not necessarily back to back, I'll take a second between, but I might do 10 high intensity med ball movements. And that might be it more than anything because of what we are chasing from that med ball quality more than anything. Now, what that looks like in terms of how we pair it with certain things. There's a lot of different ways. You can use it from a contrast standpoint. Say you have a dumbbell press movement, you want to do a high intensity med ball drill, you can do that. Or you can have it be right after your speed work, so you're not having as much kind of taxing already on the peripheral muscular system in addition to doing your medicine ball drill. So there's a lot of different ways you can go about that. But that is one big part of that training program is high intensity medicine ball work as more of a CNS stimulant. And this is again another conversation for another video. Do you need Olympic lifts? Listen, I Olympic lift myself. I enjoy doing it. Do I think a lot of athletes need it? No. If I were to pick between a baseball player, a pitcher specifically, doing Olympic lifts or jumps and med ball work, I'm taking jumps and med ball work every day. I just don't think the risk is worth the reward. That's just my personal opinion from not only a PT clinician side of things, but from programming as a strength coach more than anything. So that is really just an overview on the wide variety and differences of what and how you can use medicine ball work, not only in a rehab setting, but also in a training perspective. Because again, this is a massive piece of any training or sport performance program, and it needs to be in there because it's a big piece from a high intensity nervous system standpoint.